lifetime learners. And we really want to encourage you. This is going to be one of the big building blocks for the future. I thought this was sort of an appropriate slide. But many of you came into this program thinking about how you wanted to specialize, what you wanted to go into, maybe the practice setting that you wanted to be in, maybe thinking about one day sitting for a board exam or going into a clinical residency. And some of you may have been really surprised by your clinical and then came out the other side thinking, oh, I want to do something a little bit different than what I thought. But for right now, after taking your licensing exam, you're thinking, oh my gosh, I never want to pick up another book, at least for a while, or a paper, or anything. I just want to take a break and stop for a while. But it is our great hope that you will continue to ask questions, especially as you see your patients, to learn and to grow professionally and personally, to be that lifelong learner. Going back and reading, and I can assure you, being in schools again, going back and reading and taking courses is very different than being in school and preparing for different things. Okay, so included in this point, you guys recognize this answer to a lot of questions. It depends. And you probably found out on your clinicals that things are not black and white. There's lots of gray. And to determine which way to go, you need to keep asking those questions and keep delving into the research to see what interventions are supported and what might work most effectively. Two of you should remember this patient. And your patients and your families are going to be another building block, and they are going to be a huge part of that lifelong learning. They will constantly teach you, as I heard a lot of you share today, and challenge you. They may also frustrate you in many different ways. I'm sure that you all had experiences where you'll never forget a certain patient that you had who presented a challenge. I know I can go back to and think back to my clinical and remember everybody's name who was either challenging or that had a really great outcome or whatever. But remember that your patients and their families have a lot to show you still. And about treatment, many of you shared about how you educated or how you will perform education, to be an advocate for your patient and their family. They are rich with learning opportunities. And so you know now a little bit about what worked well, store that away into your little toolbox, and maybe what didn't work so well. And you'll remember that. And we know that as you all become CIs one day, you will have a lot of expertise to share with your students as well. You will also be learning from your rehabilitation colleagues. We are blessed to work in a profession that is very team-oriented. So there are OTs, speech and language pathologists, rehab psychologists, social workers, rec therapists, MDs, and even other PTs, your colleagues. And then you will also have your mentors. You'll have a lot to learn from all these people. So is the big picture coming into focus yet? It should be. You should have a much better idea, and as time goes on, the big picture will become much clearer. I also want to encourage you guys to find balance. You guys are actually experts at this, I think. Having to go through 3 years of school, balance the home life with school, with going out in your clinical. So I just would really encourage you to set your priorities and just really balance them and think about them. So tonight, you all have reached one of your goals. And in the future, you will also be setting goals. Many of you are already interviewing. Some of you already have jobs waiting for you. But whatever we do, we hope that you will grow even more excited about physical therapy as a profession each and every day. I know I can honestly say for the rest of the faculty that we love being physical therapists. We also love teaching you guys. So reflect on what you wrote on that essay when you first came into school, the reasons why you wanted to be a PT, the reasons why you're excited to be a physical therapist now, and then in a few moments you will be taking an oath. And really think about the words that you will be speaking and take them to heart. You guys are the future. This is the easiest way to denote future. Vision 2020. But you are the future of this profession. And I haven't had the privilege of standing in front of you guys since last spring quarter when you were in geriatrics. And it's an even greater joy to look out at you now, today. And in looking at you all, the future for physical therapy is very bright. So, it's a new beginning. You probably think I'm Dr. Seuss crazy. But it's been a joy to watch you guys learn and grow into the professionals that you become today. We, as the faculty, look forward to hearing great things from you, but also about you in the future. And we are excited and proud this evening to welcome you as our colleagues. Congratulations.